Hello, my name is Cintia Gabriela Carrera. I'm pursuing an MBA with emphasis in healthcare management at West Texas A&M University. I select the language-specific skill in intercultural healthcare communication, comparing perceived preparedness and skills in nurses' first and second languages case study by Jessica Gasiorek and Chris Van de Powell. This article was published in the Nurse Education Today, Volume 61 by Elsevier, Science Direct. I select this article because I'm one of the cases of a professional that's not speaking their first language. My first language is Spanish. So I wanted to analyze from a healthcare perspective if it was different, the communication and interaction between patients and nurses if they're using their second language. First, the world has a diverse population with multicultural workforces. This study was made because of a shortage of the healthcare professionals that is suffering a part of Europe. To solve this shortage, clinics hire staff with different cultural, ethnic, and language background. Because of this action, there was an increase in intercultural interaction and also the need to have strong intercultural communication skills in more than one language. For this study, the authors prepared an online questionnaire for the nurses working in Vienna, Austria, and they sent it through Vienna Hospital Association, which is one of the largest hospital operators in Europe. 330 nurses start the questionnaires, but not all of them complete all the items. What was evaluated in these questionnaires? First, the cross-cultural preparedness. Second, the ability of the nurses to work with new immigrants and with limited local language proficiency. Third, they would like to know which skills would the nurses like to learn in a second language. The participants had to fill the cross-cultural preparedness component about their first language and then about their second language. 223 participants speak as a second language English, 6 Serbo-Croatian, 3 German, 2 Italian, 2 Russian, and then 1 Arabic Sign Language, French, and Turkish. 217 participants of the study were from Austria, 6 from Germany, and most of them were current nurses, 179. Not all the participants filled all the questions. Among the results, the participants felt moderately prepared to deal with situations involving patients from other cultures or backgrounds, and least prepared with new immigrants with different health and religious beliefs. Participants who had received a previous training in language skills fared more prepared. Regarding the training in another language that nurses would like to learn is the way to explain to the patients the cause of their illness, how to comfort the patient, motivation so that the patient can follow treatments, and making sure that patients understand the information nurses are giving. Nurses felt less confident in their skills when communicating with patients in a second language. The author suggests that language is a meaningful predictor of skillfulness, so training program would be beneficial to improve skills when interaction involves second foreign language. Nurses need to know what to say to the patients and how to say it. Not all the participants fill all the questionnaire, reducing the sample of this study. The results were expected, since people would feel more skill in their first language. I agree with the way that the authors select their audience by sending the questionnaires through one of the biggest associations of nurses in Vienna, Austria. I think this study could have been more complete if there were treatments and healthcare cases where the nurses were part of using their second language, like how many patients from different backgrounds they attend daily, and which of those were successful treatments and which not. Can patients be part of this study and tell if nurses are really skillful in a second language? Here are some discussion questions. First, do you or your organization have a challenging case in patients' treatments because of a language barrier? Second, provide an example of different language skill communication. And third, would language limitation affect your workplace? study showed that nurses won't feel as skilled when they work in a second language. Clinics can improve this communication barrier by training their staff in second languages. Also, clinics can improve this barrier of communication by translating instruction and recommendation and printing them in different languages so they can provide to the patients, immigrant patients or patients that speak in another language with it.